I want to go back to Dr. Padma. Dr. Padma, can you tell us about the multidisciplinary management of MS and why is it crucial, and how is the treatment ecosystem shaping up? We know there are gaps, but we also are trying to, shaping up in the things which are available with the availability of innovative products. So if you can touch upon that, Dr. Padma, what you?
Thank you, Pratibha. So one is, as I said, you have this big armamentarium and you have levels of treatment. We have level 1, 2, 3, and 4 as it exists now. The medications which are low potency for, say, a low disease burden with low side effect profile. And as the disease is advanced and you have severity increasing, you do have bigger drugs which are more potent. The flip side being they do have side effects to contend with. So somewhere you would have this a tightrope walk of balancing act of what is the disease severity and what kind of a medication I need. And so you have the high intensity therapies, and I think we'll be talking about it a little later. Said that though, it is not just drugs that a person with MS would need. The entire spectrum of a disability, part of it, starts with mental health, the coping up strategy. And I said this is a young person. There are a lot of challenges that the young person has as against an extremely small baby versus, you say, an elderly person. The the challenges that a 22-year-old, the person has just finished graduation, has got an admission into a Ivy League, college, or has just got a dream job, and then is to travel and move across and live independently, or has found a life partner and there is a marriage date which is set, or is married and they're embarking on trying to get the first child. That is when this MS is hitting. And then the whole world changes. There are postponements, and then there is societal acceptance of this whole thing. So there are breakages at various levels. The person has to contend with the disease. They read the Google. The second thing is to contend with the life changes which come across. The mental health thing, something as devastating as COVID has witnessed, is happening to this individual. It's not a small thing. Said that the disease itself as is causing disabilities and the cognitive issues which may not be in your face, and it is very seldom even looked at in a busy clinic. You always look at what is a disability in walking and balance and power and in stiffness and what have you. You're not even looking at, you don't even have time to look at the personality changes and the mental health issues, and the cognitive issues come in very early, and it has been established. That is one disability. And then you have the disability measurements, which could be, they're being refined, and they're being defined well now. The composite MS outcomes, which take in different disabilities in your performance with a hand or a leg, or and then there are disability status scoring systems. You need to get certified and so on. You are looking at all this. So then you have to look at their sexual health. You're looking at the continence, the urinary and the feces continence. They may be, in a bedridden state, there would be contractures, there would be bed sores, there are, skin changes. Then there are this whole thing about disability, as I said, life after having been hit with MS, which includes physiotherapy in courts, which is not just exercise regimes, it's a whole lot of things out there. Look at the number of specialities, Pratibha. I need a urologist, I need a psychiatrist, I need a psychologist, I need a probably, the different systems which in there, and a plastic surgeon. It expands. So it is not just a clinician or a neurology. So a multi-speciality, and then throw in this big system where it needs support, the societal support, and that's where the MSSI and all these societal groups which have come across as NGOs. So you have the entire thing, and then the economics. You can't ignore this elephant in the room, Pratibha. Health economics, can't ignore them. You need support there. So when in this whole thing, I must bring in the health policy makers and implementers and everybody. So it is a joint system. So, and I think that's the reason when we say medical, yes, it is still multi-pronged, multi-strategized, so multiple level are required, but it goes beyond that. So you need a multi-pronged strategy to address this problem at the very root and make a difference to a person who's got this problem.
Thanks a lot. It shows how much multidisciplinary system is needed for MS. Thought about string of pointers there from Dr. Batma. And we have Dr. Dheeraj Khurana in charge of MS Clinic and Professor Department of Neurology, PGMI, Chandigarh, India, joining us. Thanks a lot, Dr. Dheeraj, for joining in. So I would like to, go to you and ask about the challenges first. If you can just give us, though we have spoken about it, we would want to hear from you also. Challenges faced by India due to lack of awareness about the condition and lack of trained healthcare professionals to diagnose and treat the disease. Yeah, if you can just go on with it, Dr. Dheeraj, over to you.
Thank you, Pratibha, and thank you, MSSI, for this excellent platform today. I think we've heard quite a few thoughts on the various challenges, and just to reiterate, these challenges are primarily related to a delay in diagnosis. And you know what? Usually these delays happen either because it depends upon the variety of symptoms that the patients come up with. The common symptoms being visual symptoms. You may have visual blurring, and they will land up with an ophthalmologist or even a general physician, and who may not really suspect multiple sclerosis. And what they land up doing is either no major treatment. And the reason why no major treatment is given in the beginning, a lot of these attacks are self-limiting. And that's what the hallmark of MS is versus the other associated illnesses like, say, for example, NMO or MOG. They are not as self-limiting and they are more debilitating. So MS may, in certain cases, may tend to be a little bit less debilitating in the first few attacks. So they may have milder attacks and they may get okay, and people ignore them. And that's another thing why it gets there's a delay in the diagnosis, because a lot of patients who have the first few attacks, they may get okay and they may just ignore it as a minor symptom. And we see this off and on, almost on a daily basis. We see that in our outpatient, and they don't seek help, one. And when a major attack strikes them, they come. Then I think one of the other challenges which earlier used to be there is not just lack of early diagnosis, lack of say the availability of the right tests. For example, an MRI, although now the MRI, especially in the big cities, are very easily available, and even, for minor complaints, in fact, that's got a downside to it. You may overdiagnose certain things. And thanks to the widespread availability now, we are even getting patients who do not have MS by symptoms, but who have MS by the MRI, what we call as radiologically isolated syndrome. And interestingly, that this phenomena of RIS, that is the imaging showing MS, but the patient not having symptoms, is now considered to be a precursor of MS, which has enough evidence. And we may even pick up these patients before anything happens in MS. And that's a great thing, actually, because what we were talking, why early treatment is needed in the challenges, that is the very reason, for any disease in the human body right now, we are reaching a stage, we're not reaching, we've already reached where we talk of preclinical. That is when the patients or the people do not have the real manifestations, but even have the silent symptoms of those disease. We need to treat them, because once the disease starts, there is already so much of damage which has happened, which may not reverse. So we are looking at preclinical or pre-symptomatic stages of the disease, and it's a presence of MRIs and maybe sometimes over investigation we may diagnose. But overall, there has been, I think, these challenges have slowly, I think, been overcome now, and there is a huge amount of awareness amongst the ophthalmologists. Physicians may not be as much, but if the MS patient lands up with a neurologist, there is a little chance that MS is going to be missed. And there is a low threshold for, at least in the neuro in the field of neurosciences to get a proper investigation and diagnose patients. Then these, as far as the diagnoses are concerned, these are the major challenges. And of course, uh, I'm sure you'll be talking of the challenges for treatment, which maybe you can discuss later.
Okay. So now, as we have heard a lot about challenges, now we have this question on the MS registry. How important it is to have one, to have a repository. So I would like quickly ask Dr. Rajesh. So, do we have any MS registry, and how important it is to have one?
Well, so there is a registry. I'm not part of the registry. I think Dheeraj and Padma ma'am and Netra in Bangalore, Thomas, these are the people who are presently running the registry. So I have encouraged my patients to be part of the registry. I think one of them can answer this question in a better way.
Rajesh, you should be part of this registry. I'm good. Dr. Rohit Bhatia is the principal coordinator, and it is his been brainchild to get this MS registry from the ICMR. And yes, most of us are part of it. And I must say, Rajesh, how are we missing you? You must be. You would be from tomorrow. Seriously, Dheeraj, you can explain more on this.
So
Okay, sure.
I'll,
Thank you.
yeah, Dr. Dheeraj, if you can give us some light on the registry part. Yeah.
Well, Dr. Padma's already given you the apt introduction. So yes, the registry is already up and about, and it's over an year now, which is running across many centers. I can't count them on my fingers right now, but and the centers it includes both private and government hospitals, which are part. And Rohit initiated the registry with the funding with the help of ICMR, and we've got a very, I would say, eye-opening information and eye-opening data on that. That we already have close to 5,000 patients on that, which is a huge number if we compare to even the registries in the West. Countries like Sweden, or even, which is one of the topmost countries having data on MS, they also would not have this rate of high number of patients, and that's primarily dependent on our huge population. One state of ours is probably got more population than the whole country in Europe, and that's actually a reflection. So we look forward to actually accumulating this data. And why you asked what's the importance? I think it's extremely important, first of all, to identify the clinical characteristics, but more than that, to really get identified with the burden that we are facing, which we've just been discussing. Everyone just said that MS was at one point of time not considered to be a disease of the Indian subcontinent. It was a disease of the West. But now we need to show the world that there is enough MS, and how focus has to shift. So there have been things which have happened in the last few years, which is actually focusing on LMICs, which I would maybe state a couple of them. All the development of all major medications, they took place in the West because of various reasons. You have the resources, you have the funding, but we had some low cost medications like rituximab, which we all know is an excellent drug, and it's working very well. Very recently, with the WHO along with MSIF, has given approval, and in fact included rituximab in the essential list of medications, which is a big step. And why they've done it, it is to increase the accessibility in countries like India and other LMICs. In fact, because till date, rituximab is still being called an off-license use, which gives a wrong connotation that, oh, it is not approved. Although the other drugs like Ocrevus have the same mechanism, but they're very expensive. They're 20 times more expensive. And rituximab, which although, I won't go through the entire story why it's off license, because it was not developed for MS, but the mechanism and its use in MS is excellent. It works very well in MS. And finally, now we have an endorsement from one of the big agencies like WHO, which says that it's good to use, and that's the reason, and it should be made available in all these countries, since it has ample of evidence and clinical trials also now, which almost give it like a level 1 evidence of efficacy in MS. So these are a few of the things why registries are important.
I can actually quickly, Pratibha, I think registries are important. One, to get the actual highlight the local challenges as well, and also to understand the way the disease behaves and progresses in this set of the socio-economic ethnic population. So say, for example, you take pregnancy, then you look at the medications, how across what is happening to these individuals who are diagnosed with pregnancy, what's happening to their pregnancy, how's the childbirth. So this registry would be separate. And also the registry as regards what has been the first line of drug which has been introduced into different states. What's been the average? How many of them have actually got missed? What is the timeline of from the onset of complaints to the first line of drug which has been initiated, called the treatment gap. So these are some of those things which, and innumerable, even there are radiological biomarkers which are getting in, the MRI markers. Are they different? Are they same? Is it the same as is being reported in the West? And it's mostly it is. And also some chemical biomarkers. That the list is endless, Pratibha. I think registry and close to 6,000 people right now into the registry will give huge amount of data, and this will span across now decades because the onset has been done and it is rolled out now. We need more people joining into this registry. That's important.
Yes.
Yeah.